Hey everyone, welcome back to Molan Health. You know that feeling, that uncomfortable fullness, the tightness in your stomach, maybe even some pain? Yeah, we're talking about bloating, and trust me, it's way more common than you think. Bloating can really put a damper on your day, but the good news is it's often manageable once you understand what's going on. Today, we're going to break down everything you need to know about bloating, from what causes it to how you can find relief. We'll dive into the common culprits like certain foods, digestive issues, and even some underlying medical conditions you might not expect. So if you're ready to ditch the bloat and get back to feeling your best, stick around. This video's for you. Let's get started. All right, let's get down to the nitty-gritty. What causes that uncomfortable, tight feeling in your stomach? Well, bloating is basically a buildup of gas in your digestive system. Think of it like an air balloon slowly inflating in your belly. Now, there are a few usual suspects when it comes to bloating, and we can categorize them into three main areas: digestive issues, medical conditions, and dietary and lifestyle factors. First up, digestive issues. These can range from things like irritable bowel syndrome, which affects how your gut muscles contract, to lactose intolerance, where your body has trouble digesting lactose, a sugar found in dairy products. Even something as simple as swallowing too much air while eating or drinking can lead to bloating. Next, we've got medical conditions. Now, these are less common causes of bloating, but it's still important to be aware of them. Conditions like celiac disease, an autoimmune disorder triggered by gluten or gastroparesis, where your stomach empties slowly, can also lead to that uncomfortable, bloated feeling. So how do you know if you're dealing with bloating? Well, it's not always as simple as it seems. While some people experience visible swelling in their abdomen, others might just feel that uncomfortable tightness or fullness. Here's the deal. Bloating can manifest in a few different ways. The most obvious one is that feeling of fullness or tightness in your abdomen, sometimes even accompanied by visible swelling. You might also find yourself burping or passing gas more than usual, a sure sign of excess gas in your system. But bloating can also be sneaky. You might experience abdominal pain or cramps, feel uncomfortably full even after a small meal, or have that dreaded feeling of nausea or indigestion. And keep an eye out for changes in your bowel habits like constipation or diarrhea. These can also be red flags for bloating. Chapter 3. Getting to the bottom of it, diagnosing bloating. Now, before you self-diagnose based on Dr. Google, remember every case is different. If you're dealing with persistent bloating, it's always a good idea to chat with your doctor. They'll take a detailed medical history asking about your symptoms, diet and lifestyle. They'll also give you a physical exam, feeling your abdomen to check for any tenderness or abnormalities. If your doctor suspects something more serious might be going on, they might recommend some additional tests. These could include blood tests to rule out infections or check for inflammation. Lactose intolerance tests if they suspect dairy might be the culprit, or imaging tests like ultrasounds or endoscopies to get a closer look at your digestive system. In some cases, a stool test might be needed to analyze your gut bacteria and look for any digestive issues. Remember, diagnosing the root cause of your bloating is key to finding long-term relief, so don't hesitate to reach out to your doctor for personalized guidance. Chapter 4. Fight the bloat treatment and lifestyle changes. Okay, so you've figured out what's causing your bloating. Now what? The good news is there are a ton of things you can do to manage and even prevent it. Treatment for bloating will really depend on the underlying cause. Sometimes simple dietary and lifestyle changes can make a world of difference. For example, if you're sensitive to certain foods like beans, lentils, or cruciferous veggies, try cutting back and see if it helps. Same goes for dairy. If you suspect lactose intolerance, try a lactose-free diet for a few weeks. And remember, staying hydrated is crucial. Water helps things move along smoothly in your digestive system, preventing constipation and bloating. In some cases, your doctor might recommend over-the-counter medications like antacids to neutralize stomach acid or enzyme supplements to aid digestion. And don't underestimate the power of exercise. Regular physical activity helps stimulate your digestive system, keeping things moving and grooving. Chapter 5. When bloating is more than just an annoyance. When to see a doctor. Now, while bloating is usually nothing to worry about, there are times when it can signal something more serious. It's important to listen to your body and seek medical attention if your bloating is persistent or accompanied by any red flags. If your bloating lasts for several weeks despite making dietary and lifestyle changes, that's a sign something else might be going on. Similarly, unexplained weight loss along with bloating could indicate an underlying medical condition that needs to be addressed. And of course, if you experience severe abdominal pain, blood in your stool, vomiting, or difficulty swallowing, don't wait. Seek immediate medical attention. These could be signs of a more serious issue that requires prompt treatment. So there you have it. The lowdown on bloating. Remember, it's a super common issue, and most of the time it's easily manageable with some simple lifestyle tweaks and dietary changes. If you found this video helpful, give it a thumbs up and share it with your friends who might be battling the bloat too. And don't forget to subscribe to Molan Health for more evidence-based health tips and advice. Thanks for watching, and I'll see you in the next one.